Hey, hi everybody. I'm really pleased to present to you today the results of our evaluation of Chile's law of food labeling and advertising. So a lot of attention has been paid to the front of package labeling aspect of Chile's law in particular, and so I wanted to review a little bit why do we need front of package labeling? And the reason why front of package labeling is really important for public health is because we know that people have limited use and understanding of the complex nutrition information that's on the back of the package. We also know that many food packages around the world are covered with nutrition claims that are confusing and often misleading. So for example, a fruit juice that has claims about containing fruit, despite having lots of added sugar, can be something that's really confusing for consumers. And we know that simple, easy to understand, easy to pay attention to, front of package labels provide quicker and more accessible information, particularly for people who have low literacy levels or low education levels. So this is a snapshot of what current mandatory government-led front of package labels look like around the world. As you can see, the map is really dominated by a particular type of label called a warning label across the Americas. So most countries in the Americas now have this type of front of package label. The US remains a big blank spot, but the government here is considering a similar front of package labeling option. And so one important thing about front of package labels is that they can really vary in terms of the amount of information they provide, the complexity, ranging from something like you see at the bottom, where it's really complex information, there are a lot of numbers. These are the type of labels that provide a lot of information, but we know that consumers don't understand it. That's because this type of label is actually very similar to the information on the back of the pack. People have a lot of trouble with numerical information. And so this type of label is really the least effective when it comes to consumer understanding and ease and accuracy at being able to identify products that are really unhealthy. And then as we move up, we see labels that tend to be a little bit simpler and provide more guidance, meaning that they just don't provide numbers, they actually provide consumers with some indication about the nutritional value of a product. And so the type of label I'm really going to be focusing on today is this kind of warning label like we just saw on that map. And the reason why warning labels receive so much attention and have been so widely implemented in many parts of the globe is because they're really based on strong theoretical and experimental evidence. So we've seen in a number of experiments and focus groups in many different settings across the globe in many different regions that warning labels are really effective at grabbing consumers' attention. They help people understand whether a product is healthy or not. They improve people's ability to quickly identify unhealthy products. They show consumers that there's a health risk involved in these products, and ultimately they lead to behavioral change. Now, Chile was the first country to implement this type of warning label approach, which is why it makes for such an excellent case study. So Chile is really similar to many countries around the globe in terms of having a high prevalence of overweight and obesity, as well as having a really high level of ultra-processed food intake and sugary drink intake. So starting in 2014, to address these problems, Chile implemented a set of policies. First was this warning label policy, which included labels on high in sugar, high in saturated fat, sodium, and calories, so products that had high levels of these. They also implemented a marketing policy that started with banning child-directed marketing, so using cartoon characters or advertisements on heavily viewed children's programming. And then the last piece of this policy was a school policy, which was essentially banning the sales or promotion of products that carry these warning labels in schools. Oh, one more thing I should mention about the marketing policy. I won't really be covering this today, but Chile's marketing policy expanded from that child-directed focus to, in 2018, being a full daytime ban on unhealthy food advertising. So any product with a warning label cannot be advertised from 6 a.m. to 10 p.m. in Chile. Okay, so today, for the most part, I'm really going to be focusing on the first phase of the Chilean evaluation. So what was implemented in June 2016. The policy got increasingly more stringent over time, including more stringent nutrient thresholds, and as I mentioned, the addition of that additional marketing policy in 2018. The Chilean policy, was designed, really led by collaborators at the University of Chile, and it was really designed to try to get a perspective on the food environment all the way through food behaviors, and ultimately we hope to be able to understand changes in weight and metabolic status. Just going to speed through this to keep things moving. So here I'm going to show what this policy actually looks like. So this is an example of some of the packages that we see in Chile. You can see that the warning labels are really prominent. Chile has really high compliance with this policy. So nearly all products that contain a warning label, or I'm sorry, all products that should contain a warning label do contain a warning label. We also saw decreases in child-directed marketing in Chile. So here you can see what these breakfast cereals look like before the implementation of the Chilean policies. They don't have warning labels, they're covered in cartoon characters, and then after the policy. And I think what's really important, particularly for countries that are considering front of package labeling policies, is how these policies intersect. So you can see that without the cartoon characters, the warning labels on these packages becomes a lot more obvious. So it's not just about providing consumers with additional information, it's about cutting down the noise on the packages so that people can see and understand this new information on the front of the pack. One thing that Chile did not do that I think is really important to consider is also limiting the use of nutrition claims on packages that carry the front of package warning label. So here it's in Spanish, but you can see that these products on the right still contain some claims. So we can see that the one on the left contains information about all of the vitamins and minerals that the product has, and the product on the right has a little seal that says that it's high in whole grains. So in an ideal front of package labeling policy, these types of these types of claims will be banned because they still create consumer confusion. The consumer can see, oh, this product is high in sugar, this product is high in calories, but it's also high in all of these nutrients. That can be a little bit confusing to folks. And so really the gold standard is banning nutrient claims on products that carry these warning labels. In Chile, again, they've implemented this as a package. So I think it's important to note what the changes were on food marketing. These types of policies were really effective. Even the first phase, which was just focused on child-directed marketing, reduced kids' exposure to unhealthy TV food ads by about 50%. The warning label policy also stimulated companies to reformulate their products. So in that first phase of the regulation, there was a 7% reduction in the prevalence of products carrying the warning label. So companies wanted to avoid the label by cutting the amount of sugar, salt, saturated fat, and calories. And really, I think the interesting thing to note is that most changes occurred right around those regulation cutoff values. So companies, as you might expect, only reformulate in so much as they need to be able to avoid that warning label. And we saw a lot of these changes, particularly in sugar. I'm actually going to give you a small preview of our most recent data when we think about food purchases. So food purchases results are really important to us because they show us what was actually going into people's homes, what were people buying, which of course has a profound impact on what people were eating. These results combine the effects of reformulation and the results of behavioral change. So people actually shifting away from or making different choices, not choosing the product that has lots of warning labels and instead choosing the alternative product that doesn't have any or as many. And what we see in our current publication that's under review for the second phase, which had more stringent nutrient thresholds, is that there were pretty substantial reductions in calories, sugar, and sodium, particularly for products that contain, coming from these products that contain warning labels. So people were shifting away from the warning labels and the products were reducing their content of these nutrients of concern. In terms of dietary impact, we have been looking at what the results were in children and adolescents. And what we see is a leftward distribution of the intake of these nutrients. So here I'm showing total daily sugar, and you can see that after the policy was implemented, the distribution shifts to the left, which means that kids were consuming less sugar after the policy was implemented. Now, of course, it's always really important with this type of policy because it's all about getting consumers the information that they have a right to have, whether they actually understand it. And in our cohort of preschool moms and adolescents, we found that people had really high understanding of what these warning labels mean. First of all, there is high policy support. So people felt like the government should tell us which products are unhealthy. They knew that the labels signified that a product was unhealthy, and that 3 labels mean that it's less healthy than 1 label. In focus groups, we found that the labels were really helpful in helping parents understand what products were healthy, and that the school policy was really reinforcing because children were learning about the policy in schools and then coming home and telling their parents. So you can see on the left this quote that really speaks to product categories that are really confusing. So these logos, they help you a lot. Sometimes there are things that you wouldn't even imagine had that much sugar. One thing is knowing that it's sweet, and another is knowing how much sugar it has. And then on the right, because of this new law, my daughter has been taught a lot about these Black logos. No, mom, you can't buy me that. My teacher won't accept it because it has those labels. So here you can start to see how the policy is really interacting with the school, and having this reinforcement in school is really important. So again, I already mentioned that we did see dietary changes, but the labeling policy, because it was also implemented through the schools, resulted in a really big reduction in the prevalence of unhealthy foods available to kids in school, and then reductions in kids' intake of sugar, fat, and salt in the schools as well. One important question that comes up with front of package labeling policies is whether or not it's going to have an adverse effect on the food industry. In Chile, what we saw was that there was no changes in the food industry employment or wages, suggesting that it really didn't have a negative impact on the economy. And then some anecdotal evidence suggests that the policy actually led to new business development. So companies creating new snacks that would avoid the warning label. So, of course, as I mentioned, all of these results were from that initial implementation in 2016. We have done some work to understand what has happened since then. And we did these focus groups in 2021, which obviously was during when Chile was still grappling with the pandemic. There were prolonged lockdowns there. And of course, we also had global food inflation occurring at the same time. So here we hear this quote from a parent that says, "I see the price, not the labels. Foods with labels are clearly cheaper, less healthy, and healthier food is more expensive." So this speaks to, again, the importance of packages of policy options, right? So we have the labels, and now people know it's unhealthy. But if we're not also intervening to make sure that healthy foods are affordable, this can still pose a real barrier for people. So now they know it's unhealthy, but they're not able to make the healthier choice unless they can afford it. So again, when we think about what an ideal policy package might look like, we might think about including elements of fiscal policy as well. So how can we incentivize purchasing those products that don't carry the warning labels? There are also some unintended consequences, which are important to mention. One of them relates to the food marketing policy, which is just that because products aren't able to be advertised if they carry the warning label, of course, as you might expect, there was some shifting to the marketing of products that don't carry the warning label but aren't necessarily healthy. So unlike countries that have more recently implemented this type of warning label policy, Chile did not include a warning label on non-nutritive sweeteners, diet sweeteners. And so here on the left, you can see an advertisement for Coke without sugar, again, using a child. And so this is really something that in an ideal world, we would design a comprehensive regulation so that this type of loophole can't be exploited. So for example, it could mean including a nutrient warning label on diet sweeteners, or it could include making a more strong marketing policy that says, these types of products can never be advertised, period. On the right, what we see is more misleading information that companies added to food packages to try to cover up or distract from the warning label. So you see all this information at the top of the package that is essentially saying, hey, this warning label says this product is high in sugar, but if you only eat 30 grams of the product, it's actually not so bad. So ideally, the policy would include regulations that prevent this type of counteractive marketing. And again, we see this whole grains claim in green at the top. So it would be really important in an ideal world to have a ban on this type of marketing on products that carry the nutrient warning. Lastly, in the same vein as non-nutritive sweeteners, in Chile, we saw increases in the use of these non-nutritive sweeteners. In the food supply, we saw increases in purchases and intake of these types of sweeteners. Now, these type of sweeteners were already really common in Chile and really well accepted due to decades of health professionals recommending their use as a method for weight control. But of course, this is something from a public health perspective that is really not desirable, in part because we don't know the long-term effects of a lot of these sweeteners, and largely because products that contain sweeteners are really still considered ultra-processed foods. So in an ideal world, we'd be shifting people from Coke to water, not from Coke to Diet Coke. And so again, what that means in terms of policy development is that labeling policies would consider the inclusion of a warning on diet sweetener. That would probably go a long way towards preempting this type of response. So in conclusion, Chile's policies were very effective at enabling consumers to identify products that were unhealthy. Again, these data I'm showing here on this conclusion slide are actually data in progress from our evaluation of the second phase of the law, but the policy led to substantial reductions of nutrients of concern in the food supply, particularly for sugar and sodium. It led to overall reductions in sugar, sodium, and saturated fat in terms of food purchases. Both children and adults understand the warnings, but there are some important things to consider for strengthening the regulation. So including those additional regulations on nutrient claims. So any product that carries a warning label can't contain any nutrient claim at all. And then secondly, considering a nutrient warning on non-nutritive sweeteners as well. Okay, and I just want to make sure to end by really acknowledging that this work was led by a wonderful team in Chile, led by Camila Corbalan and Marcela Reyes, as well as many other amazing collaborators. And this work received funding from IDRC in Canada, the Chilean CONACYT, as well as Bloomberg Philanthropies. All right, thank you so much.